Okay, so iontophoresis is the one we talked about where you're going to use electrical stimulation to drive a medication into the tissues. This is most common with tendinopathies. You have in your book different protocols for the different types of tendinopathies, placements of the pad for that transdermal drug delivery. It does use a direct current, but it's a low amplitude current that it's using. The light charges repel and increase skin permeability. They usually use dexamethasone. It's a corticosteroid that has an anti-inflammatory action to it. So the electrode placement, the drug delivery electrode placed over the area. So let's say it's your lateral epicondylitis. You're going to put it over that extensor tendon up there at the lateral epicondyle. And the other electrode is placed a few inches away over a large muscle belly. So you can either put it on the bicep or the extensors in the forearm. Polarity of the drug delivery electrode should be the same as the active ion of the drug. So let's say the dexamethasone is negative, then you want that drug delivery electrode to also be a negative charged electrode. You're doing this to the patient comfort, and it should never exceed more than 4 milliamps. The treatment time is affected by the current amplitude. You adjust your total treatment dose of 40 milliamps and that'll adjust to how much time it takes. It can be anywhere from 10 to 20 minutes, depending on what amplitude they can tolerate. You're always going to do safety check to patient's skin to avoid burns. You want to make sure you let them know that they should just feel a comfortable tingle. They should not feel burning sensation to let you know if they do. So this is telling you if they could only tolerate 1 milliamp, it would take you 40 minutes to get that dose of 40 milliamps in. If they could only tolerate 2, then it's going to take 20 minutes. If they can tolerate 3, it'll take about 13 minutes, and 4 is going to take about 10 minutes. So we have these different things now. In the old days, we have these machines, and we have them in class, and Dr. Smith will be showing that to you, how those are used. And we put the medicine in these patches, and then you turn the machine on, the electricity would go through. Nowadays, we have patches that are used much more frequently in a lot of facilities. And so it has a little battery in it, and then you just put the medicine in there, and it can be a 3-hour patch, or it can be a 24-hour patch. And the patient just wears that and takes it home with them. And they're pretty effective. Okay, and then we have biofeedback. We are hoping that we will get some electromyographic biofeedback machines before this quarter is over for you. But just to know that this is another option that we can use electrical stimulation for biofeedback. It's a technique that enables the individual to gain some voluntary control over a muscle or autonomic nervous system function using a device that produces either an auditory or a visual stimuli. And then we can also use extrinsic feedback. Use that for motor recruitment, motor inhibition, or pain control. So you may have a person who has some atrophy and they haven't been able to know how to recruit those muscles appropriately. So a lot of times that's in the quadricep area that we find that happens. We also find that happen a lot. Trying to think what other area I use this in. Usually motor recruitment is generally the quadriceps that I'm using it for. A lot of times I use biofeedback more for motor inhibition. So that would be like after a post-op shoulder patient, they are really overusing their upper trapezius muscles, and so I'll do some biofeedback to inhibit those muscles so we can get the other muscles to work appropriately. I use that a lot also with patients for biofeedback for women's health, and we can also use biofeedback just for pain control as well. Precautions, again, same with any other one where we're putting a pad on somebody, is that skin irritation or allergic reaction to the pad. Lack of patient receptiveness and motivation. A hemispatial neglect, so those either right or left-sided CVA patients. Decreased vision and or hearing, so you got to make sure you use the appropriate biofeedback based on that. And there's no detectable muscle activity, so that may not be something worth doing. Okay, I think that's it for electrical stimulation. We'll see you next week. Thanks. Bye.